So there's a few things you want to consider when you're thinking about exercising as far as being safe. So the number one thing that you always want to make sure to do is that you're taking the medications that you're prescribed. So your medications are your cardiac protection, so always make sure that you've had those in your system before you do an exercise session. You want to work at your own pace. So obviously if you're off walking on your own, that's not hard to do. It becomes a bit of a trick sometimes when you're in a group setting. So you just want to make sure that you're always staying at your own pace and not trying to keep up with your neighbor. We don't suggest using your heart rate as an indicator of intensity. So most of the people that we see here in our clinic will be taking medication that actually is reducing their heart rate. So to buy a heart rate monitor isn't really going to give you an accurate reflection of your intensity. So I wouldn't suggest bothering to go and buy a heart rate monitor for that reason alone. Another good thing to remember is to not hold your breath. So I don't find people don't do that when you're exercising aerobically. If you're walking or you're biking, your body sort of naturally makes you keep breathing. It's typically if you are stretching afterwards or doing any sort of strength training that people will often hold their breath. So you just want to watch that you're continually breathing, because holding your breath actually will increase your blood pressure. We recommend that you progress to doing arm activity last. So there's nothing wrong with arm activity. There's some precautions around that depending on what your cardiac event was. But we do suggest progressing to that after you have a really good aerobic base, because it will increase your heart rate and your blood pressure. And again, watch for symptoms. So if there's a change in your symptoms, if all of a sudden you feel more short of breath than normal doing a particular exercise, that's something to really watch for. Or any sort of new symptom that you haven't experienced before, then you want to report that to your doctor as well. And if you feel sick, so we use the above the neck rule as we're, if you're in cold and flu season, if you're sort of stuffy and achy and it's your neck and above, you're okay to do a light session. You might actually feel like you want to pull back the intensity a little bit. But if you're feeling achy and sore and feverish or any of those things, you're better off just to take the day off and to recover that way. We're going to talk a little bit about things that you can do to watch yourself in the heat. When it's 35 degrees outside, we want to really make sure that people understand that they can still exercise, but you just have to make some modifications. So the first thing that I would say is look at the time of day. So if it's going to be a hot day, you want to look at getting out early in the morning or wait until late at night. So not 12 o'clock in the afternoon when it's 40 degrees outside. Another thing that you can look at doing is taking your exercise session to someplace shady. So if there's a treed area that you can go to, it's generally a little bit cooler. That's a good suggestion as well. Or taking it inside. So you can go to the mall, you could go to any kind of community center, someplace where there's air conditioning is really important if it's quite hot outside. And then to watch your fluid intake. So just make sure that you're replacing your fluids, because obviously you're going to be sweating more and you're going to be losing more water that way. On the flip side, exercising in the cold, one thing that you really want to watch is that you extend your warm-up. Because if you think of what a warm-up is supposed to be doing, which is opening all your vessels up, if you breathe in cold air, it actually does the opposite. So it shuts everything down, it makes everything tight. So you're sort of fighting what you're trying to do with the warm-up. So you're actually going to want to extend the time that you warm up, and that will help you to vasodilate and open up all those vessels. So maybe even a 10-minute warm-up, maybe a little bit longer. Also really important if you have any respiratory issues to do that as well, because the same thing happens to all of your airways. A tip that can help is to cover your face with a scarf, because then at least the air you're breathing in is a little bit warmed before it goes into your lungs.